Welcome back to the Beauty Authority. I'm Tatiana Bido, Director of Aesthetic Content. Today we have Christine Chiu and Dr. Gabriel Chiu, who you may know from the wildly popular show Bling Empire, or just their fabulous online presence and presence in the world of luxury and beauty. Together they make a true power couple in aesthetics, and today we're going to pick their brains and dive into their approach to beauty and the treatments that they both rely on, and just see what's coming in the world of aesthetics. Hi, Christine and Dr. Chiu. Thank you so much for joining the Beauty Authority.
Hi. How are you?
I'm so excited to speak to you because I love talking to a power couple. And Christine, you've been so open and transparent about so many things online and on your show. And Dr. Chiu, you're a real expert in the field of plastic surgery. So thank you for coming on and speaking with us.
Thanks for having us.
So, Christine, you look incredible, always impeccable. So, tell me your secrets. What are some treatments that you rely on? What are your beauty must-haves for in office?
Well, I have to start by saying that I took being married to a plastic surgeon for granted for almost 2 decades.
You
No.
look this good. You don't need to do too much.
Oh, he's too nice. No, we got married when I was in my 20s. So in my 20s, I kind of coasted, and again, it was so accessible. The husband, all of the skincare treatments, that I didn't really dive in as soon as I should have. Now I'm not in my 20s anymore, and not also in my 30s. And so really now I have to be super serious. I think that the most important thing for me is to use medical grade, physician strength skincare, because time's a ticking, and
Yeah.
I'm not getting any younger. And the more time I waste on frou-frou, good smelling, beautifully packaged things that are not actively making a difference, the older I'm going to get and start looking appear that way. So medical strength skincare is a must. I love using in my normal daily. I actually now have a lot of different skincare products that I utilize at home, depending on the season, depending on how my skin's behaving. I don't just stick to, 5 products that I have been using forever and ever. So within that arsenal of products, I have SkinCeuticals products. I have Elastin. I've got PCA skin. And I also have Skin Better and Skin
Wonderful.
Medica.
So, those are your desert island picks that
Yeah,
you would take with you. Yeah.
absolutely.
And now you said you didn't cash in your plastic surgeon husband card early on, but how does it work now? Does he come and tell you you have to try this, or do you hit him and say, I heard about this new thing?
Now I'm begging. Now every weekend I'm begging and like pulling, strings and pulling favors to get him to come in on a Saturday or Sunday and to laser me up. I am loving and addicted to the Alma Hybrid CO2 laser right now. He can explain more about it, but the strength is very customizable and the effects are very customizable depending on if I need a quick like red carpet fix or if I'm targeting something a little bit deeper. And Skin Vive has been a saver.
Really good.
I don't enjoy it, but I am desperately like, yes, I'm obsessed with it and I'm dependent on it. I do like a cocktail or two. And so I think my skin is very dehydrated and I travel a lot. So Skin Vive gives me that glow that I really need. So those two are kind of my like must-haves right now.
So this is where I'm going to call on Dr. Chiu. What is Skin V for our viewers who are not familiar with a skin booster?
Sure. SkinVive is a product from Juvederm, and I'm sure everyone's heard about Juvederm if you've done anything in the cosmetic field, because it's a filler, or their main products are fillers, hyaluronic acid fillers to plump up your lips, restore volume, different things, and they make different products for specific purposes to kind of give you your preference of result. SkinVive happens to be a different version of it where you inject it to bump of the skin, there isn't actually a volumization that occurs like you see when you go ahead and inject it in your lips. It actually increases the hydration in the tissues and the moisture because hyaluronic acid, as we all know, it increases the fluid or the moisture in the tissues by up to 300 times its weight and draws the fluid and keeps it there. So you get that moisturized type of look, especially if you feel like your skin has been dehydrated. Um, it's kind of interesting because sometimes I don't, when I'm not like focused on analyzing something, I don't try to analyze somebody, which is a good thing out in public, right? And
Right.
so it's kind of interesting that I keep on hearing like her friends say like, "Oh my gosh, your skin is so," and they tell her how different it is, and yeah, then she tells them, and it's like, "Oh gosh, I guess I should pay a little more attention." Obviously, I'm a guy though, we don't, out in public, we don't analyze like that, like women do to each other. So it's really been a game changer, and patients who've been injecting it, they really notice a really nice improvement with the amount of moisture in their skin.
May I also add what's on my to-do list, my wish list?
Yes.
There's this new product called alloclae, and it's fat, and I don't have enough fat to inject. I really would love a little perkiness and a little bit of tasteful volume in my tush, and I don't have enough fat for it. And until recently, that wouldn't have been a possibility for me, but now it's on my list. Alloclae is going to be my little bum booster.
I have to admit that's my fault because I've been like raving about it ever since I started using it. It's something that's new. Hasn't I would say that probably about 3 months or so that it's been more commonly used. And every now and then I bump into a colleague who says that they've tried it, but I've been actually doing it for patients. I get patients of all types, and some of them are very, very thin, athletic types, and they wish they didn't have that athletic soccer butt type of a look and wish that they had a more feminine look to themselves because obviously um, they're women and uh, you work out hard to look good. And unfortunately, sometimes one of the side effects, if you happen to be of this body type, is that you can lose a lot of your softness because you lose some of that fat. So, had a patient who wanted to inject it to make her the edges of her breast implants look softer and also to add volume to her butt. And there were other products that are out there, but the return on investment hasn't been extremely good. Now, the alloclae has been a game changer in that the studies have shown after 6 to 12 months, it's been like 94% retention. So that's like incredible to me.
Now that's how I know I'm talking to a real professional because alloclae is so new, so you really are giving us your top secrets in plastic surgery. And Christine, I know that you've had a hair loss journey that you've been dealing with recently. Can you walk us through that and what's been working for you?
Sure. Actually, about this time last year, I started noticing increasingly dramatic hair loss. It started with just kind of clogging my drain as I showered to clumps and clumps of hair falling out to, being essentially almost completely bald. I would say 95, 99% bald. Um, I had like little strands here and there, and I really had to turn it entirely to wigs. There's a lot of discovery, a lot of trying to figure out what was causing this, what was at the root of this problem. And to be honest, we're still kind of in that phase. It's been a process of elimination. But what we've come to the conclusion of, and we have hired a team of scientists to reverse engineer some of the hair products that I've been using and the hair dyes. And, some of those chemicals were the triggering factors, although there was some underlying issues as well. So um, we have we've really tapped into every possible remedy, from topicals, of course, to medication, prescription, compounded, um, injections, exosomes, LED or like red light therapy,
Everything.
everything. And right now, next on my, and it's starting to happen a little bit again. So something is triggering it again. And so my next step right now, I have an infusion scheduled of all sorts of concoctions that my female concierge health doctor is prescribing.
Wow. It is a combination of things, right? As far as, like, what really is going to work. It's never just one thing, and then getting to the root of the problem is always key in the beginning, so,
Rarely is it just one thing. It's usually a combination and a perfect storm type of a thing for most patients, even though they don't realize it.
yeah.
The one thing I haven't dove into, which I really should, is Eastern medicine. Because of course we have all the access to Western medicine and all of the modalities and technologies that can help resolve this. Um, including having him come in on the weekends to do PRP and microneedling, and injecting steroids. But I really want to look into Eastern medicine because when this kind of came out and I started having open dialogue about it, I was really surprised to hear how many women had undergone or were currently undergoing a similar situation. And a lot of that feedback was explore Eastern medicine.
Amazing. Well, I love that you're so open about it because it is such a not embarrassing, but it's something that people just don't wanna talk about a lot, especially when you're going through it and you haven't found your solution yet. So, it's very admirable that you're sharing all of it, every piece of your journey with everyone. So, thank you. Okay, Dr. Chu, can you talk a little bit about your approach to plastic surgery and how it's a mix of art, surgery, and psychology for you when you are approaching your patients?
Sure. I mentioned that I love that combination of different approaches or factors of cosmetic surgery because there's the obviously the medicine that you have to figure out and see what someone needs and what can be done based on science. And then there's also the psychological aspect. Why is this patient coming in to see me? What is it that they want and why do they want it? Can I help them to achieve it? Is this going to go ahead and make them feel better as a person? And in a way, more whole, okay, more satisfied with their body, with their lives. And then, of course, the art aspect of it, which is the fact that the tissues are dynamic, meaning that you and it's not exactly like, for instance, if I gave you Legos or if I gave you pieces to um, a bike and you followed the instructions to put it together. You can teach someone how to do a surgery, but without knowing the how it all goes together, what happens afterwards, and what the effects can be, you're not going to be successful with getting the result that you want. So Um, that's why I kind of find it to be an art as well, because you not only have to um, plan on doing something to make it look beautiful, but also kind of anticipate how it's going to heal and change. So then it will look beautiful when when it's done doing so.
That's so interesting, and right now, there's so many people that are hearing about, like Kris Jenner's facelift or, salmon sperm, facials. How do you know when a treatment is right for someone, and how do you say no when they might be chasing a fad?
Well, it does come to that psychological aspect. So we need to know why is it that this person is going in this direction. Just because their friend got something done doesn't mean that it's necessarily the best treatment for them. It's not like putting on a costume or a dress or something else. You have to analyze what stage they're at to begin with, what the end stage they want to have as a result, and how to achieve it. And sometimes, depending on what it is, I'll give them a couple different choices as far as how close we can get there. At the same time, I sometimes have to explain to them, you know, this may have worked for your friend, but it's not going to work for you because, and explain to them why. So a lot of times it's a little give and take with each patient and having to explain those things.
And what are you excited about right now that you don't think is a fad, that you think is people that's worth trying?
Well, and again, that depends on exactly what every single person is looking for and needing. But the things that are out there, I don't feel are fads and are going to be around to stay and possibly to be incorporated into other modalities and even be, if you will, slingshotted into bigger and better. Um, the possibility of using these biological fillers like alloclae, the use of AI in analyzing and also helping to, well, as we know, it can go in a bunch of different directions, but I think that it's going to be like my right hand person at some point where they're going to be able, just like a caddy to a golfer, be able to give me some feedback as to how I should approach a certain person with a certain type of technique and get the result that we're looking for, or in helping a person with their healing process. Um, so these are some of the things, as well as obviously analyzing. Um, for instance, it may be able to do a video and just, or maybe AI is watching you as you're talking, and then you tell me what it is that bothers you about your face, and then it can go ahead and tell me how to do some injections for you to get that kind of a result. So this can be done in person. This can be done by Zoom, like we're doing now, and it really opens the window to a lot more accurate cosmetic procedures and treatments as well. How to give a person, uh,
Precision
yeah,
and
yeah,
predictability.
hmm very much so.
I feel like that's right around the corner, right? And then one final question for you, Christine. Is there anything else that you're obsessed with in the wellness realm that everybody should be doing right now?
I think something, and it could be age, it could be me becoming a mother, me experiencing this hair loss. But I think we really need to respect the relationship of inner and outer beauty and how they correlate and how one leads to the other. Wellness is inside out, outside in. And yeah, I don't want to throw out a teaser, but there is a project we're working on, hopefully in the coming years, that will really beautifully tie the two.
Amazing. Well, you'll have to come back and share it with NewBeauty once it's ready.
Of course, you'll be the first to know.
Wonderful. Well, thank you both so much for coming and speaking with us today. And we're going to keep watching and see what's next for you.
Thank
Thanks for
you. We
having us.
appreciate your time.
Thank you.